This is SP Reflection for the summer course, ATTR 354 with Mr. Winkleman. Basically, disclaimer real quick, I have a puppy, so if she goes crazy, you know why. We're going to start off with talking about the SPs in general, how I felt during them and how they went, and then how I can improve upon my skills and the impact that what I've just done impact on my future patient encounters. So I first want to talk about how I felt during them. Unfortunately, I didn't get as many SP opportunities as my classmates due to another class. I felt confident in the way that I felt like I could talk to my patients. Something that I've dealt with before is being afraid to even walk in the room because I don't know how to introduce myself. That's not something that I felt like I had this time. It was very much a conversation and an experience. Like, I wasn't afraid of everything. Yeah, I was nervous, definitely had some anxiety and whatnot, but I felt much more confident than usual. I don't know if it's because I remember some of my skills, but it felt really good to actually go in there and say, "Hi, my name's Hannah, and what can we talk about today, or what do you need, or what's going on," and all of those things. For went well wise, I think patient communication, I could actually talk to them, which I've said before. I may not have done all of the things I wanted for each patient, but I did something. It's been a while since I've even thought about athletic training, seeing as my job over the summer was in a food-related field, so it wasn't the same. Sorry. So I think the went well overall with just patient-centered care. Whether or not I actually got diagnoses correct or whatnot, I felt like I could actually, talk to people, which was really good. The things that didn't go very well was definitely just in general, I didn't know what was going on with the athletes, and I think that's basically, I need to go back over my pathologies, and I need to review skills practice, and because I did a little bit here and there for each patient, but I didn't really do very much. I was really bad about palpations in the shoulder one, a little bit in the elbow one as well. I don't know the SCAT 5. I hadn't seen it. I didn't realize it was, it had changed from a SCAT 3 to a SCAT 5. So obviously I'm going to need to learn that. I've never done a concussion eval before on an actual patient. And all of my preceptors always have a SCAT 3 or SCAT 5 now form. So I feel like if I needed to do a concussion evaluation, I would actually have, especially still while I'm learning, I would actually have the SCAT in front of me, because I'm not going to remember which 5 words because I'm doing all of the other things on the checklist. I'm not going to remember the numbers or the symptoms checklist and whatnot, what is supposed to calculate up to and whatnot. Especially since I haven't done any. How am I supposed to remember? I mean, I go over it every now and then. I'm going to have to do that. That's fine. It's on my to-do list of for future patient care is learning the SCAT 5 and staying up to date with the SCAT forms. Noticing when a new one comes out and whatnot. And I think taking all of what I've learned this week in preparation for a preseason internship, these SPs are going to impact my future patient care, because I'm going to make sure I have the resources that I need, the tools that I need to the SCAT forms, or I'm going to go over evaluation portions. Remember to do my manual muscle test, my palpations, range of motions, go over all of that because it's fresh and new in my mind, so I don't have to, take an extra 5 to 10 minutes just trying to remember. So I think the SPs didn't go as well as I was hoping they would. I did 4 of the 6 on Thursday. I did a lot of guessing, but I just tried to fake it till you make it. I don't think I did very well in certain ones, but I think patient-centered care is going to be a really big focus for me in the next couple weeks, because I am getting a lot more confident on my side of things. So making sure I can talk and I can relay messages, but making sure it's all based around what they actually need. And then I think I'm going to have to go over concussion protocols again, because I didn't realize you had to refer for that. I'm a little foggy about that, so I'm going to have to figure out that portion. Again, working on patient-centered care, the tools and resources, knowing the protocols and whatnot. It's going to be how I go from here. That is the SP reflection video for ATTR 354.